I've used the Israeli bandage on at least 2 occasions on subjects that were each bleeding profusely from a leg injury. The first one had bilateral gunshot wounds to both thighs. I initially applied an Israeli bandage to I think it was the right thigh. That one was bleeding the worst at the time. When I got to the end, I used the closure bar to twist the bandage tighter over the wound site, and that was effective in stopping the bleeding on that patient. The second patient I had a spontaneous rupture of a vessel in his lower leg. He had experienced an excessive amount of blood loss prior to our arrival. When we got there, we initially applied a tourniquet to his thigh. Subject was a very obese patient, about 350 plus pounds. We had a lot of difficulty in getting the tourniquet tight enough on that big a thigh. Even after cranking down the tourniquet, there was still blood trickling out of the wound site. And at that time, then after we'd gotten the bleeding slowed down that much with the tourniquet, then we applied an Israeli bandage to the wound site. Tighten that down, and we did end up applying a second tourniquet above the first one a few minutes later, more as a precaution than anything else. When I saw at the hospital the hospital staff remove the pressure dressing, I saw that the pressure dressing had actually not been soaked through. It had been enough to finish controlling the bleeding down there that the tourniquet was not quite enough to be able to handle.